Hey, John, it's me again. I'm back, and I'm ready to continue our discussion on the healthcare debate. And so, I want to read you an editorial that was in our local paper, Northwest Examiner. It's called the Northwest Examiner. It's basically for the Northwest District of Portland. It's a very small newspaper, but it's I think it's one of a great newspaper for its size. Anyway, the editor over here, Alan Clausen, here's his picture. Where is it? There. See that guy there? He wrote a very good editorial about the healthcare debate in this paper. So I'm going to read you. I'm going to read you from this editorial, okay? Because I think it's a relevant discussion here. Okay. Some Pearl neighbors are putting together a series of forums on the national healthcare debate. They have no presumed conclusions or special stake in the issue. They just want to learn and engage in dialogue with people who share their commitment to citizenship. I'm sure they've also found the angry name-calling events hosted by members of Congress across the country to be hugely disappointing. I've been disgusted with the national healthcare debate too. It's all about suspicion, hot rhetoric, personal attack, emotional manipulation, and self-interest. How can these attitudes lead us to a solution on a matter that is at its root about compassion? The effort to reduce human suffering. Universal health care is presented as a scary proposition. More scary to me is the denial of needed medical care. If we do not have a national policy of universal health care, some people are doomed to suffer pain, disability, and death for treatable conditions because they cannot afford insurance or care. Who could hear their stories and turn them away? People without regular health care don't age well. Physical complaints pile up. Most conditions aren't visible, but often teeth go bad, making it impossible to hide one's plight. How do you get taken seriously as a job applicant when your teeth are rotted or missing? Our former president and some other well-insured individuals like to assume that because we have emergency rooms, no one is without health care. But even if all can get supposedly life-saving services on an emergency basis, this does not include the medicine or the follow-up care often necessary to return to health. And hospitals do not take responsibility for managing chronic, disabling, or even terminal conditions of people who cannot pay. 60 Minutes aired a segment on Remote Area Medical, a nonprofit formed to bring health services to isolated third world tribes. Instead, the organization now devotes 60% of its time to people in the United States. Rams set up a weekend clinic in Knoxville, Tennessee, and saw 920 patients, made 500 pairs of glasses, did 94 mammograms, extracted 1,066 teeth, and did 567 fillings. Some drove hundreds of miles and waited in line for their only chance to have serious pains, tumors, and other conditions looked at, all by volunteer doctors and nurses. At the end of the weekend, they had to turn 400 people away. If you don't have health insurance or independent means in America, you might be better off in a third world country. I know people in our neighborhood who are in this predicament, and most readers probably do too, if in fact they have coverage themselves, like we do. About 1 in 6 Americans is uninsured, after all. The world's most expensive healthcare system has found one area in which it is intent on controlling costs, denying services to the poor and uninsured. Even this steel-hearted practice saves no money for society as a whole. Emergency room visits cost many times as much as the same services in a doctor's office. Lack of health care renders many incapable of full employment. Medical bills and illness cause about half of all our bankruptcies. I doubt that estimates of our healthcare cost burden account for the lenders who don't get paid because someone's finances were taken through the ringer by medical costs. Yet we carry on this cruel insanity of denying medical care to the suffering because it would supposedly cost too much. We're the only developed country in the world that doesn't consider health care a right, and our health care costs are about twice the amount when compared to gross domestic product as those in the same developed countries, which suggests we're wasting $1 trillion a year. Who still believes our healthcare system is working? And why are we listening to them? I don't know what will come up at the forums in our neighborhood, but if participants come in with open minds and compassion for fellow citizens, I imagine they'll follow some of the paths of thought that I've traveled along.